For many years, the community of Manning struggled to keep physicians.
Recruitment was ongoing for quite a few years. There was even a span of time that we just managed with locum coverage, which was not good for our community.
Since they weren't able to see a doctor consistently, many locals were driving long distances for medical services. These cows played a part in changing that.
Come on, girls!
Dr. Tyler May grew up in this area. His grandparents originally settled here to farm.
I think it's in my blood. We used to have elk and wild boar when I was growing up.
The lure of ranching brought him back.
Enjoying some dandelions.
4 years ago, he started with 15 cattle. He thought it wouldn't be that much more work to expand to 50, then 100, and today, 200. He's hired a farm manager.
Now this is where we get to make the cast look good.
Here, Dr. May teaches casting to healthcare students at an RPAP skills event in Manning. 4 years ago, he became the first permanent physician to practice in Manning for years. 1 year ago, Dr. Anzi Capon joined him as a second. They both provide care at Manning Medical Clinic and Manning Community Health Center.
I like the scope and the breadth of practice of being a rural GP. I like to work somewhat independently in my practice, and being a rural GP gives you the option to do that. We also have a very good staff at this hospital. Everybody's always been very easy to work with. I would pull that up just a little bit higher at the top. There are very few places where you can go from the hospital to the ranch in 5 minutes. And it was one of the big drawing cards for me to come back here once I decided I wanted to farm.
Dr. May practices holistic farming. His cattle are 100% grass-fed. He avoids the use of pesticides, herbicides, and chemical fertilizers.
Instead of competing with nature, we're trying to coexist with it.
He provides care for sick people. Does he also provide care when one of his llamas, pigs, or cows gets sick?
Well, I think there are some overlap, but I still do consult with our local veterinarian, who happens to be my cousin's wife. So
he feels prevention is a common trait in keeping both cattle and people healthy.
What we try and do is keep the cattle on fresh grass, keep them in new environments. Don't keep cattle sort of confined to the same area for long periods of time. We don't give disease the chance to develop that way. And I think we find that in people, if we can keep them healthy, they do a better job staying healthy.
So, is there more money in ranching or medicine?
I think that question's yet to be answered. Right now, medicine for sure foots the bills for the farming, but I hope that the farming will sustain itself once I get it built up to where it needs to be.